Hello, everyone. Welcome to our healthcare diplomacy series. This is not our first session. This is actually our third session. And I'm Dr. Haitham Hassoun, and my colleagues Art Ochoa, who unfortunately could not join today, our Chief Advancement Officer at Cedars-Sinai, in collaboration with Dr. Jerry Green from the Pacific Council on International Policy, have really come up with this idea and really incubated during this initial part of the pandemic is how to take the next step forward in our global collaboration world or global services, and really tie in issues that are related to more than just healthcare, but politics and diplomacy, but social issues, economic issues, all the things that would either boost or impede our progress for those of us who are interested in international collaborations. And so our first session we'd done months ago was on US-China. The second was on US-Mexico. Each take on a different flavor, of course, a different understanding, and we just all here to learn. This is an educational event for those interested in the topic. Today, we're going to focus on Russia, and believe it or not, we didn't really plan it, but the timing is amazing with the recent summit between the US and Russia leadership, and I'm sure many things were discussed, and we have experts here on the panel to break it down, and two guest really speakers, DJ Peterson, president of Longview Global Advisors, who's an expert on US-Russia relations, and Dr. Monish Arora, Director of Health Industry and Practice Advisory for PwC Russia. Again, someone I personally consider an expert in healthcare in Russia, and also in the context of global healthcare, someone who knows the global landscape, not entirely embedded locally in Russian healthcare. And he's going to give us perspective from a health point of view. And we're going to tie these together into a discussion today, which I hope many of you would enjoy and benefit. Of course, please do ask questions either through the chat function or raising your hand, and we'll have them addressed, obviously, by the panel. So I'm going to make one sort of last comment from a Cedars-Sinai perspective before passing on to Jerry and DJ to carry the initial discussion. You know, from my perspective, you know, I think if you look at Russia as part of the Eastern Europe and Central Asia region, you know, on our side, there's about 18 countries we view in that part of the world. And that have sort of common languages, culture, business, et cetera. About 300 million or so people. You know, that's an area that we want to have an impact in healthcare as Cedars-Sinai. And we do have patients that come to us, mostly from that region, from Russia today. We're about a 2,500 patients per year program, and about 100 come from that region. And not only do we want more with complex conditions, the opportunity to treat them, but we want to have an impact locally. And how to do that has been on my mind is something that's been maybe somewhat elusive prior when I was at Johns Hopkins and now. And that's part of the thing that I'm interested to learn is how can we have more of an impact and collaborate with the healthcare environment there. And so that really sort of what spurs me, my interest. So with that, I'm going to, Jerry, pass it on to you. And we look forward to hearing about, you know, sort of current topics, hot topics and perspectives from your and DJ's perspective.
Wonderful. Well, thank you so much. And I want to welcome everybody to what is an ongoing series of events that the Pacific Council and Cedars-Sinai Hospital are staging on healthcare diplomacy with a global focus. We are all about global LA. And one of the things that's so remarkable is we can have the Olympics every, 20 or 30 years. We can have the World Cup, once or twice in a lifetime. We have Cedars-Sinai every day of the week. And so healthcare diplomacy really is something that's really valuable and important for the community in which we live. So I'm delighted that we have Dr. Arora in Moscow and Dr. DJ Peterson in Los Angeles. I want to begin by introducing Dr. Peterson. We'll have a conversation, then we'll hear from Dr. Arora, and then we'll open the floor for questions, which you can direct to Dr. Arora, Dr. Peterson, or Dr. Hassoun. DJ Peterson is I must confess, a longtime friend and professional colleague. We were at the Rand Corporation together as colleagues. I was dealing primarily with Middle East issues. DJ was dealing pretty much with Russia issues. He's an economist. After leaving the Rand Corporation, he spent many years at the Eurasia Group, doing risk analysis for businesses and other organizations that are operating globally. He then returned to Los Angeles and is now working on these issues within our own community. He speaks Russian. He has spent a considerable amount of his professional life in Russia. And in fact, when it was the Soviet Union, not to age any of us, but some of us remember the USSR. And I want to welcome DJ to today's event. The timing is absolutely perfect. President Biden and President Putin had frankly, in my view, an overhyped but interesting and significant meeting in Geneva. So I think the first question to Dr. Peterson is U.S.-Russia relations have been characterized as the worst they have been since the Cold War. Is that true? And what is the significance of that? And again, welcome to you, DJ.
Thanks. Thanks, Jerry. And thanks to Cedars-Sinai. It's quite an honor to be participating and contributing to this. And yes, I would agree, Jerry, that they are the worst, certainly that I've known. I first traveled to the Soviet Union in 1985. It was the Reagan era. It was really the height of the new Cold War, the last phases of the Cold War. And I went to the Soviet Union to study as an undergrad to really understand our enemy, the US's enemy, and then I was a fellow at the Rand Corporation to really kind of understand, again, from an objective, an analytic perspective, what this country was, what their capabilities and interests were. And so I use those tools today still to understand Russia, and I've spent a lot of time there. And unfortunately, I would say it's about as bad as it can be or has been. And one very simple example, throughout the entire Cold War, the Soviet period, we had ambassadors in Moscow. And this spring, we pulled our ambassador. Russia pulled its ambassador. It's just really unusual. We've closed consulates. For many, many decades, we've had consulates in St. Petersburg and around the country. And when we've closed those, we've had to close our consulates. And so even our ability to have people-to-people discussions and to represent and to kind of bridge that cultural gap, it's very, very difficult right now. I would say that one characteristic or two characteristics of the relationship right now, Jerry, and I think this would inform anything that Cedars seeks to do in Russia, is actually really a very, very negative view of the other country. And you see this up and down the US, right? There's very little positive that policymakers, that people in Congress, obviously in the foreign policy establishment and the national security establishment, there's very little positive to talk about Russia right now. There's just not very many good stories. And when we hear about Russia, we often hear in the context of these kind of grinding complaints, obviously around cyber, human rights, other kinds of, obstructionism, clearly with US politics, but also in German politics, European politics. There's just not a positive narrative there. And then I have to say, if you look on the Russian side, there has been, certainly for the last 8 to 10 years, a very consistent, steady drumbeat of anti-American, anti-Western. Now, as a longtime student of Russian politics, I mean, the US has to, I think it's important for us to understand that in many ways, the US was a big winner. The West was a big winner in the 1990s. The Baltic nations became part of NATO. They became part of the EU. These were part of the Soviet Union. This was considered a huge loss for Moscow. The Eastern Europe, the Balkans, and of course, Ukraine is seeking to become more of a Western country. And so pulling away from Moscow, you see the protests in Belarus as really kind of being these constant set perceptions of threat. And so what we've seen with the Kremlin and with President Putin is he's really developed a worldview that I think is in many ways unchangeable, which is the West is hostile. The West is degenerate. Things like, inclusion, diversity and inclusion, LGBT rights, this is seen as degenerate in Russia, or at least certainly from the Kremlin's point of view. And then, of course, we represent, in many ways, democracy, and democracy is a threat to the system of government in Russia. And so, I think, Jerry, looking at and let's jump now to the summit this week. I think it was actually a very good summit in many ways. I think the US president stated the case very well. We have to find ways to regularize the relationship, to make it more predictable. The big difference between now and the Cold War is the lack of predictability. We had nuclear weapons then. We had armies facing each other in different parts of the world. We had proxy wars going on. But one of the, I think, at the most fundamental level, the relationship had developed a regularization. There were arms control agreements. There was regular contacts between military and government officials. It was predictable. It was tense, but it was predictable. In many cases, actually very stable. And I think if you look at things like cyber right now and the disruption of the Colonial Oil Pipeline in the Eastern US, how unpredictable that was, and actually how fundamental it was. I was in North Carolina. I was in Eastern North Carolina at the time. And it was shocking to see all the gas stations had no gas. There were long lines. It took me back to 1973. And I was thinking, wow, if this was indeed a force from Russia, it came all the way into Eastern North Carolina and completely disrupted people's lives in an unpredictable manner. And so I think one of the key goals of the President Biden was to start a dialogue to try and regularize, kind of make the relationship more predictable. And I think what he also did is just tone down the rhetoric. He stated American interests, I think very clearly, but it wasn't this demonization. And I think that's important because I think we have to get past that. Russia's a great country. They're a great adversary. Will always be, competing around the world and for, culturally and economically. But in many ways, we have a lot to cooperate on as well.
Let me thank you, DJ, and let me ask a related question. Secretary of State Blinken, in reference to China, said that I'm paraphrasing, the United States is prepared to compete when necessary, to cooperate when possible, and to engage in conflict if we have no alternative. President Biden said something very, very similar about our relationship with Russia. He was sort of paraphrasing perhaps the Secretary of State. Is cooperation with Russia possible? And again, I ask the question because Cedars-Sinai, we are all one species. This is an audience of people, of healthcare professionals and others. We're at what for us may be the end of a global pandemic, but for others, the beginning, or perhaps the middle of a global pandemic. Are there ways in which we could cooperate with Russia? Is Putin, the way you described him, doesn't sound like he would be willing. Would there be any interest?
Yeah, I think that the two obvious ones, and frankly, the two that the US government has talked about the most is nuclear weapons and cyber. And if you think about it, if you actually look at our nuclear posture towards Russia, we have still thousands of nuclear weapons. We have missiles, we have planes, we have submarines. We spend a ton of money competing with Russia in many ways in a war that no longer exists, or a competition that no longer exists. I think it's very clear the United States has no territorial ambitions on Russia, and vice versa. If you the Russian government, the Putin administration, has really ramped up military spending to compete with the United States, and to create a credible threat. And what they've had to do is crimp spending on healthcare and other social services. They're talking about cutting the healthcare budget in Russia right now and reorganizing it to try and get savings, in part so they can spend more on national security and global interests. So if you think about it, if we could resume arms control to just reduce the financial and military burden that those systems place on our countries, obviously we can spend a lot more on healthcare than in social services. Also, obviously, reduce the number of potential points of conflict or accidents or misperception. I think the other one, so that's nuclear, and then of course cyber. There's no reason Russia didn't get much benefit by stopping the flow of oil and petroleum and gasoline in the United States, except to show its strength, right? And I think it's the same as with Russia. We don't really have a strong interest in disrupting each other's economies at this point. In fact, we need more growth. We need much more growth in Russia in particular. So to the extent that we can cut back these pains and this really what is a tax or a cancer on our economies, I think these two are ways that could really significantly improve the relationship.
You know, and I've learned this from you, DJ, actually over the years, that visitors to Moscow and St. Petersburg have a view of Russia in its totality, which is extremely unrealistic and non-representative. What's life like outside of St. Petersburg and Moscow? And I'm delighted we have Dr. Arora here, who's lived in Russia for many years, because I still sense there may be an opportunity for us. Mayor Rahm Emanuel of Chicago always says, never let a good crisis go to waste. So I keep wondering if, given how awful US-Russian relations are, something that's more in the realm of humanitarian cooperation, healthcare, maybe there are opportunities for us. So what's life like outside the metropole?
That's a great question. You know, I spent a lot of time traveling across the entire country, from east to west, all the way out to the Pacific, Vladivostok, down to the Chinese border, up to the Arctic, in the coal-producing regions near Ukraine. And I have to say, when you get into the heartland of Russia, and that's not far from outside of Moscow, it feels like Ohio. It feels like middle America in many ways. Russians like big cars, they like wide roads, they like, they farm, they have their country house, they think of themselves as a great nation, they like their sports. It's in very much a middle America. But of course, there is a huge difference between rural and urban Russia, and certainly in the healthcare perspective. And what we've seen because of these, because of the need to cut the budget and cut spending, you've seen a lot of clinics and the curtailing of medical care, certainly outside of the big cities. And I'm sure Dr. Arora can talk about that. But, you know, one thing that's interesting is that I was just recently looking at polling data in Russia about the United States, and it really took a big hit over the last few years. The Russians' opinion of the United States, for a variety of reasons, and it certainly took a big hit last year because of their perceptions of the chaos in the United States around coronavirus, and there's terrible images coming out of certainly places like New York. But it's bouncing back, and it's interesting. And it's like, what my feeling is that despite the negative official media, despite some of the bad stories coming out of the United States, Russians actually still do have a fundamental appreciation of the United States. And I think that's a really important base on which to build and where we should be focusing.
Let me ask another question. President Putin has been in office for a long time, and every time you look, he's extending it. And one wonders how, does the average Russian favor this, or they simply are living with something that they regard to be inevitable?
Yeah, it's a great question, and it's a perennial question for us. If you look at what public opinion polling has done in Russia, and it's somewhat reliable, is that Putin still has a broad base of support across the country. And that is based on a number of factors. One is the basic issue of stability. He brings stability. This is highly valued. We live with a lot more chaos in our country. What we saw last year with Black Lives Matters here in Los Angeles, for instance, is actually a great fear. We have much greater tolerance of free speech and freewheeling media. Russians actually don't. They have their frame of reference is much more, let's say, restrained. And so I think we have to accept that for whatever reason, Putin is a master politician in the Russian context and has figured out how to stay in power and how to maintain a significant level of political support. One way he's done that, for instance, is the beginning of his tenure, he worked really hard to reconstitute healthcare and improve healthcare, which had really collapsed in the 1990s when they were following US guidance and trying to liberalize their economy. And so Russians aren't happy with their healthcare, but it's in many ways, it's very functional at a very basic level, and that's very reliable and very predictable. And that's a source of support for the regime for many people, especially in the countryside and the smaller towns and cities.
One of our problems as a country is we're not necessarily good winners. I think the model of Japan and Germany after World War II showed us at our finest, because we were, we treated Russia. We treated Germany and Japan in a way that allowed them to, to develop and be part of the world community. In the case of Russia, when we won the Cold War, I don't think we adopted a similar perspective. And I have a certain measure of empathy for Putin and others. I say this with great care, largely because we have diminished a country with great traditions, with great pride, and we were not good winners. We treated them as if we had vanquished them and as if they were insignificant. And sadly, we do that a lot in our international affairs, and I can give lots and lots of examples. I thought I must say, Biden's performance, I thought showed he was respectful of Russia. And oddly, and the question we all ask in my field is, why was Trump so solicitous of Putin? To be crude, what does Putin have on Trump? That Trump said things that were so, and I'm sure I sound political, but this is not a political observation. This is, just an empirical observation, that he gave Russia a pass on everything, which encouraged Russia in ways that don't help the US, but frankly, I don't believe help Russia either.
Right. No, at a basic level, I think Trump was enamored with Putin's ability to control the narrative on many different levels in his own country. It was, I think, to go back to what you were describing, I think the U.S. was triumphalist, and I certainly participated in. You certainly were, of groups going to Russia, Western groups trying to teach Russians to do certain things or understand certain things, democracy, of course, civil society, how to do business. And there was a notion, obviously a lot of triumphalism there. I think the paradox is, again, with Trump, there's a lot of triumphalism in the Kremlin. I think it's pretty well documented that Russia did a really good job of scrambling US politics, really using our democratic system and our social media against us and really scrambling American politics and still scrambling American politics. So I think when you saw Presidents Trump and Putin in Helsinki several years ago, there was a certain triumphalist smirk on Putin's face. It was very clear. It's like, wow, we won. I mean, this is the best scenario ever. Chaos in the United States, division. And I certainly think last year was really potentially very catastrophic for the United States in a way that was perceived as welcome by Russia. I think that's one problem that we have, is that this idea that from the Kremlin's perspective or Russia's perspective, the weaker, the more divided, the more trouble they can create in the West or in Europe that kind of undermine Western values is a positive. And I think that's potentially very destructive. And I think any cooperation, cooperative efforts, say in the healthcare arena, just has to understand there's this larger geopolitical kind of zero-sum game that's being played out that people have to be aware of.
And that's precisely what we're trying to achieve in these series of events that we're having, is to try and understanding how geopolitical issues commingle with not only health issues but public policy issues as well. I think, DJ, we're going to turn it over to Dr. Hassoun Haytham to introduce Dr. Arora, and then we will be back for questions and answers. So thank you so much for being so informative. Haytham, over to you.
Yeah. Thank you, Jerry. And actually, if you don't mind, I kind of want to, as a segue almost in my mind, is what about sports diplomacy? What about art diplomacy? What about cultural diplomacy? And one thing maybe you and DJ can comment is, it seems to me that the ability to bring people together is very important. And I wonder how difficult it is to travel between countries. I mean, pandemic aside, and how why aren't there more initiatives to bring the countries together? I feel like 10 years ago or so, maybe that was the case, but today a lot less. Can you just comment in that realm? I mean, are there just simple logistical ways of preventing people from coming together that are contributing to the poor relationship?
DJ, I'm just gonna tee this up and then hand it off to you.
Yeah.
Two things that you just said, Haytham, that we should all be aware of is the power of citizen diplomacy and subnational diplomacy. Subnational diplomacy means that Los Angeles County has the 19th largest economy in the world. The state of California is the 5th largest in the economy in the world. How do we, as Californians, both through subnational and citizen diplomacy, make a difference? And DJ, the question I specifically for you is, how do we achieve that with Russia?
Right. I think the potential is there. A lot of my early academic work was in the environmental space, and what I saw was this real, scientist to scientist cooperation, this really deep interest. Russia is a fascinating and rich place to do environmental work, for instance, and so I believe this is the same, doctor to doctor. And researcher to researcher, in the medical field. So I think and I think the level of qualifications are well matched in many cases. And so I think it's there. I think one issue that we have to think about and Cedars should be thinking about is, well, where does Russia fit in the global mix? You've done, I think very astutely, a panel on China. You've done a panel on Mexico. Those are naturals. One, Mexico because of proximity, certainly for Los Angeles, and then China because it's the biggest game in town outside the United States, and it's also a Pacific power right across the ocean. And if you think about it, think about the number of flights to Mexico from LAX. Think about the number of flights every day to China. Even as bad as things are between US and China, there's one flight you can get to Moscow. And it's farther than China. So I think you have to think about, Russia is actually far away. And in many cases, they're happy to be far away. The Kremlin has taken a very isolationist kind of approach that, we're not really part of Europe either. We're kind of in Eurasia. We're our own thing. And so I would balance out this kind of really great interest in cooperation among scientists and professionals and learning and exchange, and this sense of remoteness and having to overcome that. It's purely, in some cases, geography and logistics.
Awesome, thank you. So, we'll pivot a little to healthcare because, and Monish has been patiently listening to all of our expertise sitting here in Los Angeles, and then he's there in Moscow and has a strong knowledge and understanding, not only obviously in healthcare, but in the day-to-day life. And so, Monish really, in my view, is an expert in healthcare. If you take a swath from Russia down through Middle East, Africa, down to Cape Town, he's probably knows all that environment as well as anyone. And so, Monish, without further ado, I do want you to sort of frame healthcare between the two countries and share your knowledge with us today. Also, to the audience, and this will answer Dr. Goldberg's question because I think Monish will cover this, but please, from the attendees, just you can put your question in the chat. No question is too simple or stupid. Please go for it. Monish, the floor is yours.
Thank you very much, Hitam. Thank you very much, Dr. Green, Dr. Peterson, and thank you for inviting me for this healthcare diplomacy or diplomacy session. I do not want to be on the negative side of what we've been talking about. I want to be a little bit more, give a little bit more positivity in terms of the relationships as far as the healthcare scenario goes in between the two countries. I would say, in fact, say that Dr. Peterson talked about Russia being a great country and having a lot of potential in terms of intellectual as well as cultural baggage that they carry with them from a long time. But despite of all the sanctions and economic growth issues, I think Russia has, in terms of healthcare, Russia has continued to develop and transform its healthcare system. Today's healthcare system does or may remind some of you sitting in the audience, as well as Dr. Peterson, as remnants of the US or USSR or the Soviet system, but it is in transition. And I cannot be taking the sides of the Russian healthcare system or taking a side of the US healthcare system or any system as being the best, because I'm going to say, as Hitam mentioned, that I've traveled around the world and looked at different systems, different healthcare systems, and the way the governments and the politicians, as well as the healthcare systems and the ministries approach their healthcare system is all different all over the world. But what I have tried to understand is there is no perfect healthcare system all over the world. Everybody's trying to look for something that improves the health of the nation, health of its citizen. Now, and all the countries are trying to do whatever they have in terms of resources, in terms of physicians, in terms of equipment, pharmaceutical industry, whatever they have in their hands to utilize that as much as they can for their nation. But again, the question that comes up is, although the system suffers a lot of challenges, both that come both from the political as well as from the healthcare environment, there is, I'm saying, in an industrial society like Russia, there is definitely a hunger, I would say, and for change as well as for collaboration, as far as the healthcare community is concerned. And I think COVID-19 and the pandemic has shown us all the systems all around the healthcare, all around the world, how our health systems are, what are the weaknesses, where we have failed. And I think when we are able to understand and give ourselves an understanding that, look, we have failed here, or we have been able to do good there, and able to share our thoughts and share our understandings, that's the time when you match the healthcare systems. That's the time when you are able to make the healthcare international, not national, not US, not Russian, not African, not Indian, not Australian or Japanese. That is the point. I mean, I think the situation that we are in today first of all, that has shown us all our abilities and capabilities, as well as our negativities. I mean, say what we haven't been able to achieve in US, or what we haven't been able to achieve in Russia, or what Russia has done in terms of creating its own vaccine, for example, right? Or the same work has been done all over the world. How do you and how do you want to approach them? So we talk about a lot of, let's say, continuous improvement in healthcare. We talk about physicians talking to each other, sharing their negative experiences. We as physicians, I think Haitham would absolutely agree with me. If I did something wrong with my patient, I would definitely share it with you, because I did it wrong, because that was my practice, that is what happened. And I do not continue doing that wrong. I learn from Haitham. I improve my skills. So I think healthcare could become a kind of a platform for the Russia-US relationships, and could in fact become that kind of a let's say an advocacy platform that would let us grow into a kind of countries where you really want to collaborate. You really want to understand what the problems of the nations are, what the problems of its citizens are, right? What the society or what the community really wants from the healthcare organizations all over the world. So I think that is something that we should be talking about today. And I think I have a small presentation that will give you a brief about what, and there are only 2-3 slides on the healthcare system. Of course, Dr. Goldberg, who gave a question, was asking a question about comparing the Russian and the US healthcare system. It's a big question. I cannot put it in 2 slides, but the systems, let me just try and share my screen. 1 second.
You sure can try, Monish.
Yeah, okay. All right, here you go. So from the perspective of the figures, as PwC, we start with figures, right? So I think these figures are, I think, self-explanatory. But the most important thing that I would like to focus upon today is that even if healthcare spending as a share of GDP in 2018, for example, in Russia and US were uncomparable, even if the mortality rates are uncomparable, even if the life expectancy rates are uncomparable, there are 2 things that are comparable, and that is the top 3 mortality reasons, right? Cardiovascular diseases and oncology. Of course, we're not talking about respiratory diseases or nervous diseases as being the differentiator here, but this is something that both the countries had been working on for a long time. And I would say that NIH, the National Institutes of Health, the American Health International Alliance, as well as the Civilian Research and Development Foundation in HIV/AIDS, all these organizations have been working really hard for the last so many years in bringing together the work that is being done between the Russian and the US healthcare community. There has been a development of a Russian American Medical Association, which is an independent voice of Russian-speaking medical professionals in health legislation and policy. St. Elizabeth's Medical Center in Boston, for example, it's providing care to Russians living in that area. The American Eurasian Cancer Alliance, which was formerly called the Russian Cancer Alliance, has been providing technical assistance together with the U.S. National Cancer Institute. But the thing is that all these initiatives that had been working before the sanctions started, they were all very limited to so they were all like sole works that were being done. So there wasn't a communication channel that was built between the two systems, and there was no collaboration kind of a thing. It was all about me being the American Eurasian Cancer will work only with the cancer institutes, nothing else. We don't give a damn about what does the Russian healthcare ministry thinks about that. So that kind of a thing. So this is something that we need to start avoiding, and what the first step that we've taken as PwC is recently we signed an agreement with Joint Commission International, which all of you know. I mean, it's a part of the JCAHO that accredits medical organizations for quality and safe patient care. So PwC has come into a strategic relationship with Joint Commission International in November 2020. And the sole purpose of that is to talk about quality and safety of the medical care and the healthcare provision that is being, the healthcare that is being provided today to the Russian citizens. So as you, that shows that the Russian system itself is now more inclined towards giving a safe and quality-oriented, quality-based care. And that is the initiative, not only from the government, not only from PwC as a company, but also from the government's side also, because they want the country to develop into a developed healthcare nation. Now that would mean that if US has something to offer, Russia has something to offer, moralizing each other and giving and trying to show that, okay, you are superior, I'm better than this, or I'm better than you, so that is not going to help. So I think a Russian-American healthcare committee that brings in all the stakeholders together and onto one, like kind of an intermediary platform to mediate those relationships is, I think, the only answer to improve the relationship between the physicians who are really as I said in the beginning, they are really they really want to come in contact with their colleagues. They want to understand what's right, what's wrong. They want to share their experiences, and for what? It's not for me to get a diploma from Harvard, or to get a diploma from UCLA, or get a diploma from any other renowned medical university in US. It's to provide a better care for my patient, who's sitting next to me, right? So I think that is something that what the Russian healthcare community is looking for. Healthcare has to become international. It cannot be local. It is local, but it is now too global after COVID to not to think about getting the platform ready. So I think that I would stop here and go back to a little bit about the Russian healthcare system, or let's say the way it really differentiates itself in numbers is that the Russian healthcare system today is kind of semi-national, or let's say I would say budget insurance based, where 63% of the healthcare the share of payments comes from the federal mandatory health insurance fund that is funded by the government, and only 5% comes from the private insurance, while 14% of the healthcare expenditures are from out of pocket. So people spend, so 14% of the total expenditure is out of pocket, and 18% is funded by the government on various national projects. While in US, I don't need to explain your healthcare system in terms of how the spendings are done. So that's something that really differentiates Russia, because it's mostly budget insurance based, or government insurance based, or public insurance based, and people still spending their money out of pocket. So that's where the total is 19% of the total payments that are market-based rates. So most of the payments that are done by the government, they are subsidized, so and uncomparable. So that is one of the issue that does not allow the system to grow at a pace that the US healthcare system grew in its time. So today, the Ministry of Health, as well as the government itself, is trying to expand and trying to get the healthcare more closer to the citizens of Russia in the regions, as we spoke about regions, that the regions are different from the metropole cities, and that the care provision is limited at some places, or in some regions like Far East, or in the post-Ural region, so or in the Siberian region. So we have been working very closely with the Far Eastern Ministry of Health, and are developing different let's say systemic changes, bringing in systemic changes that could bring healthcare closer to the people. So use of telemedicine, use of digital tools. All this is coming. It's all working in Russia. The only thing is that we have to raise those iron curtains again. So it's like we have been behind those curtains for a long time, and the sanctions have made things even worse. So Dr. Peterson, so you're absolutely right in saying that we have to start working, we have to start talking, and the timing for this discussion is absolutely perfect. And I would still call in Cedars-Sinai as well as the other organizations to come together and again try and build up a kind of a common platform. Not individuals, not physicians talking to physicians, me calling Dr. Haitham, hey, look, this is a situation with my patient. What do I do? It has to be an organized system. It has to be an organized structure that connects the two countries, that connects the two systems. Slight information on the situation with COVID. I think that's something that a lot of people are interested in. This is the information as of June 16th. Number of infected per 100,000 people in Russia is around 3,533 people, and the number of deaths per 100,000 people is around 85 in Russia as compared to US. But apart from that, or besides that, I would say the vaccination rates in Russia are still very low and very poor in comparison to US, where 45% of the population has already been vaccinated, whereas in Russia only 9.8% of the population. Well, again, so that shows it is very difficult to understand the Russians. I think Dr. Peterson definitely understands what I meant to say. I tried to literally translate the Russian word of что умом Россию не понять. You cannot understand Russia with your brains and minds and thoughts. You have to live, you have to be there, you have to understand. I'm going to say why it is happening. It's very local. So it's coming up. I'm going to say I think people are, the government is taking all the steps, and the ministries are taking all the steps to get people vaccinated. So I think this situation will change soon. Opportunities. This is a big word cloud in front of all of us. I think there are a lot of opportunities in terms of what the intermediary or what PwC can do, what you guys there and sitting in the US can do, what different organizations in the US can do. And I think one of the most important thing is educating, right? Education is something that that will help all of us to develop. We have stopped reading books. We have stopped educating ourselves. We have been talking a lot, but we haven't been educating ourselves. So I think education is something that, and upskilling is something that needs to be, needs to become an agenda for that discussion. The other things that I think important is to bring up use the knowledge and understanding of healthcare digital solutions that US has been kind of implementing for a long time, and share your experiences with the Russian healthcare system. And I think that is something which is of utmost importance right now, because since COVID, the distances have even grown. They've gone bigger. We have been. There has been a lot of different distance between Russia and US, as DJ said, right? But COVID has increased those distances. So how do you use digital transformation as a source of bringing people together? So I think healthcare digital transformation is something that we can talk about. System transformation. How do you transfer? What issues did the US have, or the US healthcare system had to go through while you were transforming, or what you've been able to achieve? So that's something that I think we can talk about. Improving efficiencies in healthcare organization. How do you manage? How do we manage? How can Russia, in terms of what is happening today in all over the world, in terms of where we have seen our loopholes, where we have seen issues that have come up with that have just floated up in different countries. So how do you prepare yourself for such situations? So preparedness, surveillance, emergency care, regulatory changes, talking about client-oriented approach to care, investments in healthcare industry. That is all. That's also open. associative work together with different organizations. I think that so you talk about healthcare. So there are a lot of subjects to talk about, and opportunities could become, so one could lead to another one. So I think it's just the question of bridging up the two countries and the two systems, and you will find a lot of opportunities coming up between the two countries. I'll stop here because I don't want to take a lot of time, and then I'll just be open for any questions and answer. We can talk a lot about all this stuff here, but I think the time is too limited for all of us. So I'll stop here.
Thank you, Monish. That was great. Jerry, you have you want to comment on the?
Sure. I want to thank you, Dr. Arora, and you answered our first question before it was asked, which is Dr. Jorge Goldberg in Mexico City, who spoke at one of our earlier events, was asking for a comparison, and what you provided was really, really detailed and interesting. Let me just start fielding questions. I just want to remind everybody, just go to the Q&A prompt, and you can type in your question, and I can pass them on. And this is from Hortensia Bessiou, and I apologize if I've mispronounced your last name. Excellent points made by PwC, knowledgeable and not same ideological perspectives about the U.S. and Russia, which I agree. It was very, focused on healthcare issues in a way that's very, very constructive. And what Ms. Bessiou said is it's an interesting idea to have a network in the U.S. that would work closely with Russian counterparts. And her question is, who would the Russian counterparts be? And what might this look like? And the only thing I would add to that is if they're doing it in Cleveland and they're doing it in Boston. I'm from Boston. I know St. Elizabeth's really well. Los Angeles is much, is certainly as logical, if not more so. There's a large Russian-speaking population in Los Angeles. If you walk through LAX, you see the Aeroflot flight loading up on a daily basis, transporting people to Moscow. So it's a really good question, and I would ask both you, both of you, DJ and Mortem, what might something like this look like? Is this something that Cedars-Sinai might take a lead in?
Do you want to take that, Nathan, or should I?
Well, here, I'll frame it. I mentioned everyone's perspective on it, and I know Hortensia, and thank you for the question, and thanks, Jerry, for elaborating on it. I think there's two parts to it, and you did frame it. I think Hortensia is thinking about who in Russia could be our sort of friends and colleagues from Monish's perspective if we were able to consolidate in the U.S. Group. And I think you highlighted, Jerry, those players are known. It's ones who are active globally. It's the Hopkins and Cleveland clinics, and certainly Cedars-Sinai now is in that sort of group. But beyond that, there's organizations. I was fascinated to learn about JCI and PwC, what you're doing, Monish. I think that's amazing. I think JCI is really has a role to play, and if they can turn that into being, there used to be on the back end of us academic medical centers being the ambassadors or doing the diplomacy, and they come in and do the grunt work and benefit from it. But if they can break the ice and help build it, I think that's great. But let's go around, DJ, and then Monish can come from the Russia side. I mean, what thoughts do you have on this question? I away from the healthcare alone.
Right. I guess I just have two peripheral, or maybe I guess tangential observations. Is to what extent can on the U.S. side for Cedars-Sinai mobilize the Russian-speaking professionals in healthcare in Los Angeles? That just my husband is at UCLA and often deals with Russian speaking patients, and this just having that cultural affinity, in the healthcare setting, I think is really critical. A lot of Russians travel to the Middle East for healthcare. They travel to Western Europe, right? But they're dealing with Europeans. If they can deal with Russians in the United States, in Los Angeles, in the healthcare setting, I think that would be just interesting if there's a way to mobilize that. The other question I put this out also to Dr. Arora was, I find the Sputnik vaccine to be fascinating. The numbers are pretty good on it. It's in the ballpark, at least, but there were real problems, obviously, around perception and the way they went about it. Is there, can you imagine at the beginning or last summer when the U.S. stood up its vaccine funding, if they reached out to Russia and said, we want you to participate in this, and we want to share data, and we want to give you money. Think about if we had the Sputnik vaccine as well in the pipeline. It's nowhere on our horizon in the United States. And so it's a well-respected institute, Gamaleya Institute in Russia. Again, can we think about these partners, which are in some cases acting or working in isolation right now, but obviously at a very global level of proficiency?
Can I add one tiny thing, Monish, and then you'll answer, because the data you showed on the UAE and Bahrain on high levels of vaccination are a triumph of Chinese vaccine. The Cleveland Clinic is in the UAE is giving Chinese vaccination to patients. So it really illustrates that the players that we don't necessarily associate coming together can do remarkable things. So I'll turn it over to you, Monish, but it's a really interesting question.
Absolutely right. I think, today, at the moment, there are no formal organizations that are fostering relationship. I'm answering the question that I just came up, and research. Absolutely, I'm looking at the questions and answering immediately. Yes.
Could you repeat the question, because not everybody sees the question. So if you could.
I have the question was, can research be the starting point of that relationship building? Absolutely. And Dr. Peterson said absolute right thing. If Sputnik was available to all, or was if there was a possibility at that time, and if maybe Mr. Putin and Mr. Biden would have met before, or it would have happened a little earlier, maybe things would have been absolutely different. And I'm not here to talk about any specific vaccine right now, okay, because that's not right to talk about. But the question is that in general, so you're absolutely right that those organizations, people know, for example, people know in Russia, the Clevelands, the John Hopkins, MD Anderson, it's known, the MGH. I was in Boston for 2 years myself, so I have been promoting while I was working as a physician. Now, who in Russia, who in US, is it the two ministries? Are those the two top organizations who have proven to be the best practicing, or is it Cedars-Sinai? Who are those organizations? And this is the question. So to open up the market, or let's say to open up the arena for the US and US health industry, or to open up an arena for the Russian research organizations, or even physicians or organizations that want to cooperate and associate, I think let's say PwC could be a good platform for that. Okay, we could work on that, because we have PwC in US that is working very closely with healthcare organizations in the US. We do a lot of work with the organization here, so we could create that platform and be that catalyst for these organizations who want to come together. So I'm saying, and we know exactly who is looking for associations. We know organizations who want to be identified as Cleveland's, or as MD Anderson's, or as Johns Hopkins, or Cedars-Sinai. So there are organizations like that, and the Research Institute of Gamaleya, for example, is an example for that. They want the identity. They want their own personal identity, that yes, they belong to the same community, that people should be knowing them, right? And I think I'm absolutely sure biologists and virologists from US, they know a lot of physicians, a lot of colleagues from the Gamaleya Institute, and they might be talking over the phone all the time. But the question is that it's all done behind the scenes, and we want it should come forward. People should know that we are talking, all right? And as we said, most of the problems arise when we don't speak, when we don't talk, when we don't express ourselves. So let's start doing that. I think that's one of the most important messages that I would like to give, and PwC can absolutely be involved, and we do wish to bring in such organizations together and create that platform together with any organization in the US that is ready to do that. And I think in PwC US that absolutely immediately. I would say that.
I think our time is up. Gosh, it went so quickly. I want to thank DJ Peterson. I want to thank Monish Arora. Tom, I'm going to turn it over to you as our leader to tantalize.
Yes, thank you all. I think you're exactly right. Time sort of escapes when we get into these fun conversations, and there's so much to tackle, and we tie in diplomacy with healthcare and business and international business. I think, Monish, you kind of, the last question that came up was about, I think you indicated these relationships are often grassroots, and we need to do a better job doing more of that, but also kind of formalizing it. I want to end, and I think many attendees, some are hanging on, and thanks for those who endured the big Anglo battle between England and Scotland. You missed the second half. They tied 0-0 for anyone who's into European football or soccer. That was a big match today. So Scotland kind of made it 0-0. That's a big win. But I want to end on something we do that's kind of fun. Is each of you give one word for the future, and whatever comes to mind, we really want to hear it. So I think, DJ, I got to start with you. You're our guest of expert from from the diplomacy side, and give us your word for the future.
Predictability. That's what I'm looking for, is that we can bank on the future, and exactly what Dr. Arora said. If things can be regularized or institutionalized, it would be brilliant.
Awesome. Monish, what do you think? Give us a word for the future.
Collaborative. That's it. That's the word. That's the keyword. We have to start collaborating.
We love that.
And I think we need to start sharing. That's it. If we would have continued, I would have spoken much more about this. But I think collaboration is something that should be the keyword. With
predictability, collaborative.
Predictive.
Jerry, give us your word.
My word: collaborative and predictable. I agree with the expert. They are
way
both
to hedge
right.
your bets.
Both right.
My word is hungry. My word is hungry. I'm hungry to learn more. I'm hungry to visit Russia. And right now it's my time for lunch. I'm hungry. Thank you all. I thought it was an awesome session. You guys are amazing. Monish, thank you for dialing in late in the day. The attendees, I hope you enjoyed that and benefited from the conversation, a wide conversation on the topic. Thank you all.
Thank you very much. Thank you.
Thank you, everybody.
Bye-bye.
Bye.